ladies and gentlemen. Welcome back. Good afternoon. That's the spirit, Sylvia. All right, friends. As you can see, this is the group picture that we took yesterday. And today what we are going to do right now is that my colleagues are going to come to each one of you to give this picture in this form as a souvenir for you to take back home and remember that you were part of this summit, and also to remember that you made some commitments here also.
Get in the picture.
Everyone should get in the picture. If you're not in the picture, you have to get in the picture. And if you are in the picture, you have to get others in the picture too. So this is a souvenir for all of you. All right, friends. I will request the colleagues and ushers to please to do some shepherding and bring all the guests after lunch back in the hall so that we can slip into the presentations. But before, ladies and gentlemen, we do that, let me show you a 5-minute video which was done on digital birth registration project by UNICEF. But when this video was made, the project was in the first quarter. So you will actually, on the map, you will see only Khyber Pakhtunkhwa, Punjab and Sindh. But then the footprint of the project has increased after that. I will request my colleagues to show the video.
As a country, where over 200 million people from diverse cultural backgrounds reside, Pakistan stands as the 6th most populated nation in the world. It is alarming that millions of children in Pakistan still remain uncounted after birth. The country's recorded population excludes over 10 million children. That's 66% of all children. For every 3 births in Pakistan, only 1 is registered. And this is mainly due to several barriers faced in the birth registration process. Jeet, who was born in a minority family in Badin, Sindh, is among the millions who have still not been registered.
अजीत जैसे हज़ारों ऐसे बच्चे हैं जिन्हें अपने हुकूक के बारे में पता ही नहीं, और उनके वालिदैन को ये पता ही नहीं कि उनके बच्चे अगर रजिस्टर होंगे उनके क्या फ़वाइद होंगे। जो मराइल हैं रजिस्ट्रेशन के वो इतने पेचीदा और मुश्किल हैं कि वो बहुत से वालिदैन उसमें जाना ही नहीं चाहते, जिसकी वजह से हज़ारों बच्चे जो है रजिस्ट्रेशन रह जाते हैं और अपने हुकूक से महरूम रहते हैं।
The conventional registration takes about 2 to 3 days to process and involves repeated visits to the Union Council office. While data is still manually entered into registers and then NADRA's civil registration management system.
The poorly equipped, understaffed and underfunded offices, along with low capacity levels among staff and paper-based systems, cause delays in the registration process.
In view of this situation, the government brought together the public and private sectors to initiate the Digital Birth Registration Program, the first step towards speeding up the birth registration process. The main partners in this program are UNICEF, Telenor, and the governments of Punjab and Sindh, who worked together in 2014 to develop a system which involves the use of a mobile application to improve birth registration rates.
Under the partnerships, lady health workers, marriage registrars and Telenor franchisee staff is trained on the mobile application. So whether the birth registration data is entered at a Telenor franchisee, by the salesperson or by the lady health worker at the doorstep, the same birth registration data is transmitted over a 2G, 3G or 4G network to the respective Union Council office. Hence, the end-to-end process is made efficient and simple.
The data then reaches the district and provincial offices, where higher officials monitor the performance in real time and also use it to make important decisions. Jeet was the first child to be registered at his home.
It was very simple. Karam Ali came to our house and registered Jeet on his phone. He also explained the benefits of registering him online. We didn't even have to leave home.
In another application of the Digital Birth Registration Initiative in Bagpatan, Punjab, Muniba is also getting registered. Marginalized groups, including minorities, persons with disabilities, refugees, and orphans, face the greatest barriers to social inclusion because of a large difference between the birth registration rates in the lowest and highest wealth quintiles, along with highly varying rates between urban and rural areas and provinces. Birth registration does not just ensure social equality, but also prevent exploitation, child marriage, and miscarriage of justice.
All I had to do was give the officer some details of Muniba's birth and my family, and he registered my daughter.
As the strategic objectives of each partner in the digital birth registration are aligned, its scalability and sustainability remains high. It adds to the government's national development strategies, UNICEF's goal to strengthen the realization of child's rights, and Telenor's ambition to use technology to empower and improve living standards in local communities.
Pakistan is now on the right track of fulfilling multiple sustainable development goals, particularly those relating to the children as well as commitments made under the Convention of the Rights of the Child. We aim to attain universal birth registration by the year 2024 in line with the Goal 1 of the Asia Pacific Regional Action Framework 2014.
The infrastructure of the local governments allows for large scaling of the program to make it nationwide, since they are overlooking its implementation.
Pakistan, as signatory to the United Nations Convention on the Rights of the Child, is responsible to undertake all necessary legal, administrative and other measures to ensure that every child is registered at birth and the name of that child and identity is legally and officially recognized.
A National Civil Registration and Vital Statistics Coordination and Steering Committee, which was constituted in 2014, has contributed to developing birth registration strategies in Punjab, Sindh, Khyber Pakhtunkhwa, Kashmir, and the FATA, ensuring sustainability even after achieving its primary goal to count every child by 2024. From registering Jeet and Muniba to counting millions more, the Digital Birth Registration Initiative will continuously ensure that the footprints of every child are implemented in the state's records. Because ultimately, it is our goal to count every child, because every child counts.
All right, friends, we had quite an eventful group work today, the earlier part of the afternoon before lunch. Some groups struggled a lot when it came to time management. Some groups struggled a lot when it came to ideas management. But that's the fun of a group work. I'm sure you all had a great time. So what we are now going to do, ladies and gentlemen, is that we are going to see the presentations of the groups. Every group will be given 5 minutes to present, because it's not a long presentation. It is just a summing up of your conclusions and your ideas, and 5 minutes of presentation, and then 5 minutes of question and answers or any inputs and suggestions. I am a bad guy, you know that since morning, but I will be even more a bad guy this afternoon because I'll have to keep time much more strictly. So, since Dr. Shagufta has to leave for Lahore, so we will not go in the order of from A to E when it comes to presenting. I would request Dr. Shagufta Zareen, Program Director, PSP Unit, Health Department, Punjab, Lahore, to please come forward and present her group's work. The title, the thematic area was Death Certification and Cause of Death / ICD Coding. Ma'am.
Since only 5 minutes have been given to
आप
me,
ऊपर भी आ सकती
so
हैं या नीचे?
I'll just rush through the presentation. Rest of the things can be covered in question and answer session. So, can you please play?
G, Group D.
So, thematic area was Death Certification and Cause of Death, ICD Coding. And the first question was, please play. 5 minutes na bachche, jaldi. In view of exceptionally low death and code registration in the country, what do you think are the barriers and possible options for improvement? So we wanted to discuss what are the barriers for not registration of death in the country. And the options are, barriers are number one, absence of uniform death certificate in the country, not only in the country, but in the province, in the region, and in the districts as well. No systematic arrangement for ICD-10 coding. We are unaware of this coding. We have not been trained for that. Lack of coordination for data sharing between health department, local government department, and NADRA. No legal binding on the doctor, on the medical officer to issue death certificate in case of hospital-based death. So if the patient wants, death certificate will be issued, otherwise not. Death declaration certificate should be different from the death certificate. So this is, the idea is, doctor is going to sign a slip or a certificate that is not valid in the courts, because in courts, the valid certificate is verified by NADRA. So death declaration slip or certificate should be signed by a medical officer or doctor who is dealing with the dying patient, and death certificate should be issued by NADRA. ICD-10 code shall be adopted at national level and the state level for uniformity purposes, and standardization of ICD compliant death certificate where the cause of death should be right in the frame of ICD-10 coding. In GB or other areas where women don't have property rights, usually such type of certificates are not used. Next question was, how was the information relating registration of death occurring in the community and private hospitals can be tapped for improvement? It should be part of a legal framework for CRVS that new housing societies who are having all the data of the residents in their head office, that should be a legal binding for the housing societies to register the death and share that data with the local government offices. And same should be with the private hospitals. Then prayer leaders or imam mosques. Actually, they are the people who are leading funeral prayer. जनाजा वो पढ़ाते हैं. So they should be in the loop. जो भी वो जनाजा पढ़ाएं, that should be actually entered in the data form or the data register, because he is the right person who knows all deaths in his vicinity. Then involvement of Union Council, actually, that is the key area. Union Council has to coordinate with Health Department, with NADRA, with Imam Mosque and community leaders. Next question, please. What is the current status of community-based death registration using verbal autopsy method? Right now, LHW network is working all over the country. Only this is the network that is conducting verbal autopsy of maternal deaths only. So the areas that are covered by LHWs are reporting maternal deaths, verbal autopsy of maternal deaths. Uncovered areas are again vacant places. Another obstacle is that reporting is in the form of a manual forms. So manually data is collected and dumped at one place. Again, Punjab has taken a lead and we have made an electronic form of data. Third, अगला question पिछला वाला पहले. how to ensure the registration of unnatural deaths, that is roadside accident, suicide, police information, etc., and its collation with central database. Again, ambulance service, because these are the services that are going to pick up dead bodies from the roads in case of road accidents. So that should be a part of a loop. Secondly, hospital-based deaths, like if the body is being transported to the hospital facility, again, that death is already in the record. So the death that is outside the hospital, in the case of suicide or homicide, uske liye ye procedure ho sakta hai. In case of suicide, of course, again, Imam Mosque. Because funeral prayer he is leading, Imam Mosque should be involved. Wo home-based death, in case of homicide, he will report that to Union Council. And in case of roadside accident, ambulance service should be taken into the loop. Next question, please. From your province, please quote institute or hospital pilot project where deaths registration along with ICD-10 coding is being adequately practiced. Right now, we don't have any such example in our provinces, but we have heard, I'm not sure about that, but we have heard Shifa Hospital and Indus Hospitals have already piloted that project, but since there was no one around to give accurate information about that, again, the hearsay is, yes, it is mandatory in Shifa Hospital, but actually, no one is going to follow that practice because consultant is coming, he is declaring, okay, the patient is dead, the cause of death is this, and you can enter that in the form. But again, ICD-10 coding is not according to the wishes of the consultant. We are using our layman words, or you can say the local words, and that is not in compliance with the ICD-10 coding. So next. Thank you.
Wow, Dr. Sahiba, you still have 17 seconds. You saved 17 seconds.
Yes,
all right, any inputs or questions? I must appreciate the flow of presentation was very clear-headed. Thank you for this presentation. Yes, Major, just a moment, sir. Now, please.
The word Nadra, I have read a number of these certificates which are being issued by, not that we are very possessive about the name. When the name as such comes on a birth certificate, Nadra, it looks that it is issued by Nadra. So that
even if you are possessive about it, there's nothing bad in it.
We are definitely, but if hospital is issuing a certificate, if had to be even used, it should have been discussed with us, at least.
We want to develop a system in collaboration with NADA. We can have a separate meeting for that. Because we have already developed hospital-based death certificate, death facility. Okay, thank you.
Thank you. Any other input? So let's compliment Group D for a very nicely, clearly laid out presentation. Thank you. From D, obviously we have to move to E. And let me invite Major Aftab Salim, Director, CRMS, National Database and Registration Authority, NADRA. And the topic of their group work, the theme of their group work, was innovative approaches for data access, use, and quality.
Am I audible? Thematic area 5 and the subject was about approaches for data success and use and quality. Please move. Please move. These are the data providers, NADRA, local government statistics, health, and the users are not visible. I'm sorry, they are here now. Next. Next. This is how it looks to me, the data generation process. I have to look at the data generation process, that who all are generating this. I've talked about yesterday. This arrow is basically, this indicates about the intervention. And the intervention is then by the development partners, who the intervention is by the development partners now, like UNICEF, etc., that they are trying to ensure that this process gets more multiplied so that the speed of registration can be increased. That is what this arrow indicates. Next. There are 3 stages: data providers, data users, and intervention is done by the providers, basically international partners. Next. This I have discussed the role of the citizen as far as the provision of the data is concerned to the database. The first role, the most important, is of the citizen, which has never been discussed. Next. Then the local government goes through all these processes and receives, verifies, notifies, manually registers This I learned today, that there is a difference between then manual registration, then to system registration, and then system certification. And this I've discussed with Madam Saliyub Asti. Till the time the data is not part of a systematic theme and arrangement, it is not data, it is something else. Next. This is the role of NADRA, which has been discussed time and again. If somebody wants to ask any question, he can ask me subsequently. Next. This is the end product of this cooperative effort, that the verifiable, reliable data can be stored at NADRA database system. Next. How to generate quality data, and then that is, I've discussed yesterday, that if you introduce an online environment, that will be a great leap forward to increase the quality of the data. Next. This is basically, this is how the data is defined. It is if it is accurate, complete, reliable, relevant, and up to date. And the purpose for which we are collecting. As far as the birth registration is concerned, the target is under 5 years children. And mind you, we are not achieving that target. At the moment that we are fairly below that target. We are at times register a child worth 17 years of age, and we say that we have registered a birth. That is a wrong analogy. Next. Online environment, which I have discussed yesterday also, this is what it is going to do, that you are going to get a verifiable data which can be then subsequently tracked, and report generation can be made easy if we go through an online process. Next. This is how it is going to cost to NADRA. If we go to an online environment, it will be slightly expensive than the present system. Next. The impact of online environment, you can see it will remove duplication from the registration records. It will reduce the compilation analysis time, improve sorting, processing, and then reporting and dissemination is the ultimate goal of CRVS that can get a great help. Next. How we can link all these departments. Next, please. This is how all the departments can connect through existing legal framework which is available. If a legal framework is not existing, that should be created, and that is how all the departments can link with the NADRA, where we have a central data server available. Next. Promote the secure data utilization, how it can be done. Next. You will have to create a framework, you will have to identify the stakeholders, lay down the TORs, and create a legal framework, which is the requirement of CRVS. There will be a requirement if there is, we have some MOUs with local government. If some other department comes in, it will be done through some kind of an MOU. Legal arrangements will have to be made. And then when the whole thing is complete, then we can utilize the data through existing IS policies. Next. This is how it can improve the other administrative areas. It can control child labor, violence against the children, then underage marriages, law and order situation, human rights, social security system, and then the biggest advantage which you will get is that the pilferage and wastage of the national and international resources which are being directed for this purpose. Next. CRVs can help, say, health policy, education policy, housing, employment, and then CRVS, if it is done, I have read it all across. Out of 17, there are only 3 goals in which CRVS data is not required. You can imagine the importance of CRVS is how much important. Next. Please, next. CRVS pilot project, we have been talking about that. How can we see that are there any pilot projects at national level which are being done in Pakistan? Please, next. This is what my group was. Next, please. Please, click करें जरा इसको. Any reporting system, my group said this thing, which integrates existing system of local government, CRMS, NADRA, is recommended by the group. And this we can discuss, and this is a lengthy discussion which we can have in subsequent sessions. Next. Click करो इसको. Current practices for data generation dissemination. Next, please. Data is collected through existing systems. It is then sent to another center server. Sharing is done on requirement basis with the ministries. Interior planning and other government institution stakeholders regularly engage NADRA for the data sharing purpose. Entire thing is done in IES security policies systems. Next. Next, please. How to promote the culture of, next please, इस culture को कैसे promote करना है अपने, enhance cooperation to create linkages between NADRA, local government, education, health, law, social security department, etc. Introduce IT-based culture in the all the departments, promote increased reliance on statistical reports, ensure reports are based on authenticated systems, and promote regular integration among related departments. Next. Innovative ways mean to generate data and to create interim reports. Next, please. Related departments can engage with NADRA for the existing reports which we have. Reports, I know, the way data is being reported, that type of reports we have. For example, in one of the district, in one of the provinces, I will not name, in entire year, 1,500 children under 5 years have been registered. So that is a gray area which we need to address. Online linkages, if it is created between different stakeholders, that will definitely be great help. But all the stakeholders, that is the citizen, local governments, NADRA, CRMS, health, education, social sector department, statistical department, everybody will have to come on board. Next. Suggestions, next please. Create legal framework, holistic approach बनाने की ज़रूरत है, create joint working groups. This is one of the most important suggestion which has come out of my group. Synergize and describe the key processes. Next, please. This is the essence of the entire presentation. These are the key processes: occurrence, notification, validation, verification, registration, certification. Till this point, everything is being done. Now, at the moment, things are being done at this level. But from here, CRVS starts. Quality control, compilation of reports, generation of statistics, and then dissemination. I have been thinking from where the CRVS starts, in fact. This is the point. Ultimately, CRVS starts from this point. At the moment, before quality control, everything is civil registration. And everything beyond QC, starting from QC down till dissemination, is CRVS. Please, questions.
Major Saab, thank you very much. I think the segregation between civil registration and
CRVS.
And vital statistics part, the segregation was very nicely put by this group. All right, friends, any questions to this group or any input?
Yeah. I'm Dr. Nasir Mohiuddin from Ministry of Health. My suggestion would be that in your recommendations, they should be a bit more extended, not only to generate data or statistics, but to utilize them as well. Because creation of statistics is certainly very much required, but for policy making, maybe planning department or maybe some health department or education department, whatever it is, they have not to use actually statistics, but that have to be converted into some meaningful, understandable version, which a policymaker perhaps who is not a technical person, who he can or she can understand that what these statistics mean. So I understand that your emphasis was more into generation of statistics, but perhaps I would like to re-emphasize that the statistics need to be translated into some meaningful, version which a policymaker can understand and utilize. Thank you.
My emphasis was basically on how to manage the time. Basically, my emphasis was how to manage the time. While we are, whenever we are asked about generating a report, it is explicit enough to be understood by anybody. Anybody can read it very clearly. Recently, I had to generate a report, and I was disappointed as well. And that was how many children under age 5 were registered with us. I will not quote the details, but I had the district-wide data available with me. So numbers are there, and the number of children who under age 5 have been, say, registered in a particular district, that is very easily understandable. So for that, you do not need an IT background. Wherever there is a requirement of IT background, we'll certainly provide the details in a manner that it is not difficult for the people to understand. Please.
Great. Thank you very much, Mir Saab. Bahut-bahut shukriya. Friends, ladies and gentlemen, let me move on to Group B, Physical, Human and Financial Resources for Civil Registration System. I'd like to invite Professor Dr. Amna Mahmood to please come forward and present. Professor Amna is Head of Department, Political Science Department, International Islamic University, Islamabad.
Thank you. So I am very grateful to my member of my group. They have given a very valid input, especially for the delegates from Afghanistan and delegates from UNICEF Balochistan. Actually, we are going backward. My presentation starts from, since it is titled Group B, it means that we are actually focused on collecting data and hurdles in collecting data. And what Majors have presented and what doctors have presented, that was the end game. But we will go back and we will discuss that, how we started with. Please, next. The first question is, what is the current situation of infrastructure, human resource, and their capacity for the smooth running of vital events registration? That is the current situation which we presented here. What are the adequate or necessary measures? First, you know that at ground realities are very difficult. And next, please, the first question. Multiple institutions are responsible for registration that leads to obviously confusion and complications, and these complications are visible at multiple sites because people are having very low level of awareness, and we cannot locate the responsibility that which institution is responsible. Though it's very good that we are getting information from multiple dimensions and there is no possibility to miss the information, but at the same time, having located responsibility in multiple institutions, the practical experience of Pakistani institution is that assigned to number of people and nobody is working as in reality. So that should be, obviously we want data from health department. We prefer to have local government to provide us data, and at the end product is coming from NADRA. But at the same time, I think that responsibility should be located in one institution. That may be NADRA because that is comprehensively performing the function. The next, that we are having available human resource, little availability of human resource, and that availability is meaningless because they are not having their capacity to work. We normally say that there should be more staff, there should be more human resource available for data entry and so, and number of times our colleagues pointed out that local government, only the one secretary is responsible for data entry in local government union council. But I think that it doesn't matter. It matters that what the capacity of that person, whether he is sitting on a sophisticated computer, an effective networking system, and giving input for even the entry of 5,000 people. On the other hand, if somebody is doing, he is under capacity, he is less educated, he is not equipped with computer, certainly he is not able to manage even a few hundred entries at the end. Now we come to the building infrastructure, that it is pointed out from our delegates from AJK that after the earthquake of 2008, the infrastructure could not be restored at the Union Council level. Institutions are existing by, they are actually the nominated people. The other, that local government elections have not been conducted since 1990. It means that we have to build up and strengthen the institutions at the grassroots level, which are held responsible for communication, effective communication from masses and flow of data from masses to the CRVS system. Then network facilities, certainly we have discussed multiple times that network, both mobile network and internet network, that is not available everywhere. And when we talk about the remote areas, that is not available because it cannot be transmitted. Our delegate from Balochistan, and he is head of UNICEF there, he pointed out when we are transmitting data through obviously on hard copies, we are cutting more trees. That is another problem of Pakistan. So it's better to provide effective networking system so a hard copy of data can be transformed from the grassroots level to the highest level to NADRA. Next slide, please. Second question is, what are the adequate or necessary measures to maintain the smooth functioning of the entire process of registration, certification, storage, retrieval, and transmission of legal and statistical information? First, again, we pointed out efficient communication is required at local government, NADRA, household through health workers, social workers. Instead of union council, there should be village council as KP, as in KP. That is very important point. Our union councils are scattered, especially in GP where the population is scattered. Same is the case in Balochistan, the largest province. Population is scattered. So union council is not able to effectively transform the data, gather the data from villages in scattered areas. So KP has experienced this, and they have put it into experimental design that they would make a village council. A union council is basically a village council, and so data is collected effectively from that village, and that would be transmitted at the higher level. Now we come to the monitoring. Monitoring mechanism should be there. Instead of the Union Council data CRVS to be transformed to NADRA on monthly basis. We suggested that because we have another question that how would you manage the data in disaster situation. So till the arrangements are not done for effective networking and internet, provision of internet and computers at the grassroots level in Union Council or the Village Council, till then we have to manage that all the data is transformed or transmitted to the relevant authorities, upper level, and then at the last level, that is NADRA, on monthly basis, so that there should not be any opportunity, any possibility of lapsing if you are having a natural disaster or earthquake or so, and then you will find that the whole area or the region is no more on database if you are not having record transfer to the main offices. Next, the capacity building of staff. Please, I can't see from here. Okay, the last point is that buildings should be provided because buildings are the problem, and no proper place is there. And since we are talking about the data, so data management is very important. There should be proper, adequate almirahs or storage for keeping the record, and obviously the training for keeping the record is also required for the people managing that. And for that purpose, the group discussed that till the time there is no provision of the adequate buildings by the government, then we can use some like OTAK or some Baithak of the person who is managing as head of that union council. And that is very obvious in villages when local infrastructure is provided, a culture of Chopal is there, so that can be used for maintaining data and having communication with the people for the collection of data. Next. Suggest special measures required to protect vital record. I have already discussed that. So next, last one. Last question is, what initiative could be taken to mobilize and empower social and health workers? We already discussed that there should be a utility of existing manpower in the form of health workers, social workers, and we should take on board the civil society already working in the field. Next, please. Last is the recommendation that responsibility should be focused in one institution. Then local government should be strengthened by conducting elections in time and providing adequate funds to local government institutions. local panchayat system and mosque system should be utilized because my previous colleague discussed that how mosque system can be used for that and how deaths and birth record can be, and even for marriages, nikah khan is actually the custodian of mosque as well. So we can place a register there and we can have the record of all these events, and that can be utilized for the national purposes. Donor agencies and private sector should be on board, and they should be like we have discussed in Lahore that Telenor is doing help, and every birth is on every birth a message is generated, and that is very simple manner to collect data and transmit that. Thank you very much.
Dr. Saba, बहुत-बहुत शुक्रिया. Any questions or inputs to the group? Aha.
So I have saved 5 minutes more.
You have saved, but you took 2 minutes, 17 seconds extra already. But thank you very much. I think today everyone is cooperating and understanding the importance of keeping time, so that we are already actually 35 minutes behind, so I'm just trying to catch up with time so that we end the day on time. Thank you very much, Dr. Saba, for cooperating. We now would like to move to Group C. Thematic area was registration practices, coverage, and completeness. Dr. Jasim Anwar, he's a consultant on CRVS. There he is.
How much time I'm allowed?
So 5 minutes you will present, and 5 minutes we will ask you questions.
Thank you so much. This is the most technical area. Let me introduce my group first. Next slide. Very technical people around. It was very hard for me to keep them on the point of discussions and reaching to the conclusion. Next slide, please. These are the group of people. Some of the names were missing. I apologize for that. We can add them later. So let me jump to the next part. The presentation of the technical area was about increasing the coverage, completeness, and the registration practices. To first give you an overview of what is coverage and completeness. These are the 4 events currently in practice in Pakistan: births, deaths, marriage, and divorce. Next, please. Next. Population provided the services of CRVS divided by the total population constitute the coverage of CRVS in Pakistan. Next. What is completeness? It's slightly different than coverage. Next. Number of registered events by the total events in a population. So coverage and completeness may not be the same thing. You can have an 100% coverage, but out of those people who are provided the services, they may be 10%, 20% people utilizing that service. That makes the completeness of CRVS. Next. So there are different ways how we can measure these population events. Direct ways, indirect ways, but that's not part of discussion, so I'll quickly go through it. Direct method, indirect method, matching, record linkages, next. And then demographic analysis and some statistical models that can give us an estimates of a total events in a population. So now I'll go to our questions that were presented to us, and I think there was some earlier deliberation in the provinces. So all the provinces, KP, Baluchistan, GB, Sindh, they formulated some recommendations according to the questions that were given to us. So I just want you to focus on those wide points to save time and try to finish in 5 minutes. Best practices, suggestions, increasing coverage, completeness, quality. Next. So if you look at the local government, they suggested to increase the number of units at the local level, which may vary in provinces like village councils, and somewhere there are committees and etc. So that's one way of increasing the coverage. Then the other point is we need to strengthen the reporting mechanism. There we need to use the technology, hybrid ways, the different mobile apps and ABCD. Then there was another suggestion that we should have, like in some parts of Pakistan still practice a designated person like Chowkidar, or maybe some places like Union Council members to nominate the reporting of these events. Next, please. Then the registration process should be simplified. That we can do by increasing the access. That means opening up various units in hospitals, like some part of Sindh, they are doing that. And also making the forms available. Also increasing the duration of, initial duration of registration from 60 to 100 days. That may increase that may simplify the process. Another suggestion from our group was to link these events with incentivized programs like BIS, Insaf Card, PM Card, Health Card. There are many other programs running in the provinces. Another thing was to link these events with immunization activities or any other campaigns that's being managed by the health department. A very good suggestion, free certification for poor and marginalized population. There are certain segment in the population, BSP was suggesting to use their cutoff point, which is 28 out of 100, to give those people as a free certificates, whereas the government of Pakistan can plug in that amount to the NADRA, which is an authority. They don't have that enough resources to cover that fine. Next, please. Other question was the message of CRVS to be disseminated across populations. Next. Advocacy materials, FM channels, there are many other ways that should be considered to increase the awareness. Seminars, workshop like one we are having over here, also needs to be at ground level, local levels, community level, UC level, to have more awareness on these events. Next. Third question was current practices, barriers, marriage, divorce, and migration adaptation. Currently, adaptation is not being considered. Also, migration is not part of CRVS events, but still, we deliberated on these points. Next, low literacy and awareness, population issues, cost, they're all barriers. Unawareness, and then some nikahs, non-conventional ways of nikahs, so they're all barriers. Next. There are different acts that exist, including a provision for minorities, but there needs to be some more legislation, bylaws to be formulated so that minorities should also be engaged in the process of birth, death, marriage, divorce registrations. Village communities, volunteers, another way of reducing these barriers. Next. Fourth, demand creation. There's some overlapping in these questions, but we believe we split it out. We try to make it more clear. Events at community levels through using existing structures. Next. Special registration campaigns was a very good idea, but Bhatti Saab, DG Local Government Punjab, and also like this event, 28, 29, we can consider it, or we should make it as a SARC CRVS day, so we can celebrate these days every year, or maybe like campaigns, like MNCH campaigns. So these kind of initiatives will obviously increase the demand. Public-private partnership, and then community, civil societies engagements, organization engagements. Also, I mentioned earlier, linking these events with the social services. Next, please. Any other important consideration for national census? We have few points in that as well. Next. Awareness, integration of various services, hard-to-reach areas, especially like tribal areas, deserts, flood areas. There should be some separate strategy to cover these areas. With this, group comes to an end. Thank you so much. Open for questions and answers.
Yes, ladies and gentlemen, the floor is open. Please, if you have any questions to Dr. Jasim, feel free, raise your hand. You were too good, Dr. Jasim. There's no question. Thank you very much. Thank you. We move to Group A now. Finally, Saqib Aleem Saab, Dr. Saqib Aleem, who's a consultant on CRVS, will present on development of CRVS legal framework. There was a hot discussion, the most sensationalistic and spicy conversation for himself was held in your group, right? Am I right?
Very right.
Very right. All right, Saqib Saab, over to you.
Thank you, Tausif Saab. First of all, I must thank my group. That was a very, very dynamic, vibrant group, and we had very lively and very, very productive discussions. And we have just, there was very little time available to us to reach at a consensus because of the issues that were involved. But we arrived at a consensus, and some recommendations I will be making in my presentation. And all these strengths which are there in this presentation are because of the members of my group. And all the weaknesses which are still there in my presentation, those are because of me, because I could not just make timely intervention to remove them from our presentation. So we start with the presentation. First of all, our topic was, please, first slide, development of CRVS legal framework. So we started off with the existing laws, and we try to cover what are the existing laws available for CRVS registrations. And we came to the conclusion there are a lot of laws. As per one member of my group, he said that there are hundreds of laws. There are not hundreds of laws, but definitely there are quite a number of laws that are available, especially in the area of marriages, registration, the conduct of marriages in various religions and religious groups, and then their registrations. And there are a lot of laws, and those laws need to be harmonized, and a way forward has to be created so that CRVS's ultimate objective of universal registration, making universal registrations, and then generating regular statistics, vital statistics from those registrations can be achieved. So the first law we dealt with was first question: how do we feel about the national uniform CRVS law? What could be its components? So next, please. So there basically two way forwards were available to us. The first one could be that a altogether new law be enacted, and the other option that could have been we can go right now is just to basically increase the effectiveness of the existing laws, remove the contradictions which are there, and then just generate and accelerate the registrations of births, deaths, marriages, divorces, and all the other vital events in a citizen's life. So our consensus was that given the present day scenario, as per our constitution, which was enacted in 1973, we have a federal structure in Pakistan, prevailing federal structure. And that constitution has been made by the consensus of all the parties and all the political groups that were operating and have had representations in the then National Assembly in the year 1973. And only recently, in the year 2012, an 18th Amendment has been incorporated in the Constitution, whereby there used to be a concurrent list in the Constitution that has been removed from the Constitution. Now there is only one list, and that is the federal list, containing two parts. And then all the other subjects are with the provinces. All the residual subjects are in the provinces. So first of all, we saw that whether the CRVS legislation is the federal legislature's domain, or it belongs to the provinces. As far as the citizenship laws are concerned, those laws are part of the federal legislative list. Serial number 4 of Part 1 of Federal Legislative List, which is given as a fourth schedule of the Constitution, and it is based on the Article 70, Class 4 of the Constitution. So, as far as citizenship, naturalization, and migrations into Pakistan, interprovincial migrations, migration into Islamabad or vice versa, everything belongs to the federal government. And that's why national registration of citizens, as far as citizenship is concerned, because if a baby is born and it is registered somewhere as a citizen, so that baby acquires its citizenship. So that belongs to the federal government. As far as provinces are concerned and the local councils are concerned, they are also within the domain of making those registrations, because they have to provide these civic amenities to all the citizens. If they do not have any data about the citizens who are living in their areas, or are working in their areas, or are moving about in their areas, they cannot plan or provide those services. So this basically CRVS registrations, these are the domain of both the federal legislature, consisting of the National Assembly and the Senate, and combined together they are called the Parliament, and the provincial assemblies. And through the provincial laws which have been made by the provincial assemblies, by the local councils. So these things are done. And the other consensus we achieved was that if we go for the change of role of any department, that will, because of a very, very fractured political environment we have during the recent years prevailing in Pakistan, it will be rather difficult to achieve a consensus. So it will be better that existing laws are maintained and those are harmonized with each other, so that there is a continuous process of registrations from the local councils to the NADRA, to the federal government, and then generation of vital statistics by NADRA, because the local councils do not have the capacity to generate the vital statistics. But that basically, that trade and that movement should be two-way. No, that should not be a one-way movement, that the data is being generated through registrations by the local councils, goes over to the federal NADRA, but the vital statistics are not generated and not provided to the, as Major Aftab Saab just pointed out, that thing has not been undertaken in hand by NADRA as yet. So that was our consensus. Next, please. So are the existing CRVS laws sufficient, or certain changes have to be made in them? Next, please. I will just. So as far as the basically the laws are sufficient and not sufficient at the same time, because certain lacking areas have to be covered. For example, next, please. Just previous slide, please. Previous. For example, there is no law currently available to cover the adoptions and causes of death. There is a very important area. That has to be basically incorporated in the existing laws. That there is no role of the health departments. Health departments, most of the births and most of the deaths are occurring in the health institutions. But there is no role in the relevant laws of the health department. So they should be covered through the making amendments in the law, so that births, deaths, and all the other vital events can be timely and following a proper legal way, that those could be registered. Next, please. Similarly, the local government laws, they just because the local councils are basically making these registrations and making these vital events basically recorded somewhere in their records, but there are a lot of lacking areas in their laws. For example, there is the question, then if you have to just cover these things, then the role of the Council of Common Interest, that comes into play. Council of Common Interest has been created by our Constitution, and it has 8 members. Prime Minister is its chairman, and 3 federal ministers are nominated by the Prime Minister, and 4 chief ministers are its members. And its decisions are taken by a majority, meaning thereby that 5 at least should agree to something. Then they can make a recommendation, not take a decision, but make a recommendation to the Parliament, which ultimately decides in joint session about the final. It has the final authority about that. So that this legal way should be adopted to make laws, so that the federal laws that need amendments and the provincial laws that need amendments, those can be amended. Next, please. So the next question was, how could timely registration of vital events be ensured? Do we need laws, rules, or bylaws? Next, please. So our consensus was basically rules and bylaws are also important, But because of the importance of this subject, wherever necessary, the substantive laws need to be amended so that there is more force in them, and those events and those basically laws can be made more effective. Next, please. So what are the most appropriate options for registration fee? Next, please. So our consensus was making provisions in the federal and provincial laws for appropriate funding for CRVS registrations in the relevant laws should be done. And preferably the currently applicable fees or birth and death registrations may be done away with. This is important, but that cannot be easily achieved because NADRA has quite a substantive financial resources, but their resources are limited. So it has to be properly funded if these things have to be implemented. And same goes for the local councils. Some local councils are quite resourceful, but most of them, because most of them consist of the union councils or village and neighborhood councils in the Khyber Pakhtunkhwa province, those need to be strengthened through financial allocations and things like that. But those should be covered in the laws and then in the rules and then in the bylaws. Next, please. So what roles and responsibilities could be assigned to various CRVS departments? How could these be implemented? Next, please. So existing laws, our consensus was that existing laws be amended to harmonize these roles, but no role of any provincial department should be tried to be eliminated in this process, because then the forces of resistance will come into play and the vested interests will come into play, and then it will become difficult to implement and amend those laws. So it is better that whatever some department is doing right now, they should continue doing that, but that should be integrated in a national system through a comprehensive legal framework, and then that basically legal framework be properly implemented. And then a very important drawback which is currently existing in the local government's laws, but not in the NADRA's law, is the lack of confidentiality. NADRA has very ample system and very ample provisions as far as its law and its system are concerned. But as far as local councils are concerned, there is no law. As far as confidentiality is concerned, they have made certain bylaws which are model bylaws. They have adopted those bylaws, but they can change anytime those bylaws. That is their sweet wish. If they want to publish these entire data they have, and they just move a resolution, they will be 100% right as far as their laws are concerned, but that will be very, very inappropriate because of the confidentiality of a person's vital statistics that should not be made available to unauthorized persons. So that should be covered in the amended laws. Next, please. Then what are the other important suggestions in this area for national consensus? So next, please. So basically, our consensus was that whatever amendments have to be made, and that needs a very, very laborious exercise, but that through that exercise, the laws should be the amended laws should cover both the CRVS registrations and their lacking areas to create linkages with the existing laws and the information available in the national database. Because as Major Aftab said in his presentation, that vital statistics, that is the lacking area as far as all the organizations are concerned. Pakistan Bureau of Statistics, that is generating some vital statistics, but as far as NADRA and other organizations are concerned, that is a lacking area, and that law should be amended, and then rules and bylaws should be properly amended, or new rules and bylaws be issued, so that all the lacking areas can be covered, so that a proper system can be put in place, first through the legislation and then through the practice of an implementation of that legislation. And just before I part, there was a suggestion that was not in our domain, because when we were talking about the marriages, there are a lot of marriage laws. So there is a Pakistan Citizenship Act 1951, whereby Pakistan's various categories of Pakistan's citizenship have been defined. So there is a there is a provision in that citizenship by marriage. But there is a citizenship by birth. All of us were born in Pakistan, so we are citizens by birth, most of us. So, but there is a provision for citizenship by marriage, and it is given in that section, particular section, that if a Pakistani male marries a foreigner, and after some time, and according to the requirements of that law, that woman can acquire the Pakistani citizenship. But there is not the other way around. If a Pakistani woman marries a foreigner, so that foreigner cannot acquire the Pakistani citizenship as per the existing law. So that was a recommendation that there should be gender parity, but that is not in our area because that belongs to the citizenship, basically citizenship domain and the marriage domain. We are basically just talking about the registration of marriages. So that is basically a diversion. But because it was, some members of my group felt very, very strongly about it, so I thought that it should be also be placed before you. Thank you very much.
Sir, बहुत-बहुत शुक्रिया आपका. Thank you very much. I will appreciate if I can have a show of hands. Major Saab, how was it possible that you don't give an input? Please, can Kashif get us the microphone, please? Thank you.
Just one comment on the information which is being generated at local government level and then comes to Dadra. We have IS security policies available. Just to inform the House, these are SPIs, in fact, sensitive personal informations, and everywhere there should be some kind of mechanism available, even at local government level, to ensure that SPIs are properly secured. Second question is, if somebody is here from Bureau of Statistics, what is the basis of generation of their reports? Can somebody reply briefly?
So I will try to reply both of your questions. First of all, I must appreciate that Dadra has a very comprehensive system. Although sometimes some rumors were basically carried into the press that Dadra's database has been sacrificed or has been hacked, but those were just rumors. So by the grace of Allah, the Dadra's data is secure and is in secure hands. So, but that we have to basically amend the laws as far as the local government's data is concerned, because that is a very sensitive area.
Last input from this table, please. Thank you. Ji Bhatti Saab, आपका mic on है.
Sir, आपने बड़ी अच्छी presentation दी. You told that Nadra have some very good system for the confidentiality of the matter, and on the other side, local government doesn't. I may correct the record that in presence of right to information law, how can one say that this thing is in confidentiality and this is not? When any person comes to Union Council under the law, we are bound to provide the information, whatever he wants. Thank you very much.
First of all, just to answer your question, as far as the concerned person, if any person, I don't know the exact detail of your law, but if it is written any person, that should be changed into the concerned person. For example, if I have made the registrations of my children, so I have the right, my wife has the right, and those children have the right, and certain other people who are associated with my children, they have the right, but no other person has the right to just
Right to information law provides that any person can get any information provided it is declared as confidential. So I believe that the information in the union councils or even the Nadra, I don't know what kind of information.
As a matter of, yes. As far as Right to Information Act is concerned, personal law and medical records cannot be provided. So even if there are some lacking things, that those laws also need to be amended.
Dr. Mustaqim has an input here.
For
please.
General public.
Okay, we have a comprehensive law on it.
Maybe he can find a solution.
Since we are talking about the CRVS development now, these are the first step towards that. So I would like to ask you if there are some kind of a legal connotation to standard system development and then information coming, because the federal role is more also towards the use of that information, the vital statistics, the production of vital. So how you perceive that? Because we are very keen to go
as
for
a matter of fact,
uniform
this
national
is
system.
Dr. Bursaleen Sahib has asked a very pertinent question. Because vital statistics, there are very specific provisions in the Nadra's law and in the law of the Pakistan Bureau of Statistics. That was enacted in the year 2011. To keep the vital statistics secret and confidential. You can system the overall statistics. For example, there are how many, what is the birth rate, what is the crude birth rate, what are the causes of deaths, things like that. But those have to be approved by the government or by a certain authority in those laws, and then those have to be generated, the areas which are related to census. But for example, if the American government demands that because a lot of Pakistan is basically producing a lot of terrorists, or as India says that Pakistan is exporting a lot of terrorists, that is a merely false allegation. We are a very peace-loving nation, and unfortunately, we had certain terrorists operating in our area in the past. We have eliminated most of them by the grace of Allah. But and they say that we need all the biometric information of the Pakistani. That is a very, very important area. Biometric information we cannot provide because that can be misused, and that can be misused to just declare any innocent person as a...
Let's put our hands together for Saqib Saab and Group A. Thank you very much, sir. Bahut shukriya. All right, friends. Now we have to do a quick 2-minute exercise. I would like all the ushers to jump in now towards the tables. Every one of you is getting, now listen to me carefully, every one of you is getting 2 cards each and 1 marker. Just close your eyes, put your minds in a relaxed mode. Think of the last 2 days that we have had together so far. What I want you to do on these 2 cards is in English, just write 1 or 2 lines, just catchword in bold, legible way. Think out of the box and give us a unique idea for CRVS. Civil registration and vital statistics. We have been listening to different presenters, we have been listening to different experts, we have been listening to other delegates from Maldives, from Afghanistan, from... Go through that, come up with a...